Of course, you have to think in terms of which is the best way, the simplest.
Yes.
That you can use. For example, for us, we have realized that public health, health education and promotion and protection are the most important. Now, for you to talk to a group of women, maybe in market day or in some after church, it has a lot and it can improve. So you don't need money to do that. So it is the fact that you must realize how best can you pass your message, and then how do you keep on repeating it so that people will understand it. Now, we are now in our primary schools, we make use of the children as a vehicle for education. You can tell them, for example, when you go back home, tell your mom if you don't have chlorine to put in the water, then you have to boil the water, and then children have to go to bed early so that they don't get mosquito bites. And these things help a lot. It doesn't have to be money always, but it's just what you can do with the little that you know.
I know that Alola Foundation is a really big NGO in East Timor, and one of the things they do, I think, quite well is the education and information. Mana Angelina, do you want to talk about how Alola passes out health promotion, health information messages around East Timor?
Yeah, education is really important because to change someone's life, they should receive a good information about the impact of the health to their life. So one that Alola do in the community-based group is we training the community members about the health information. So what we implement in the village level is we call the packet information. So it includes the basic safe motherhood information and family planning information, and also about the community-based promotion about the breastfeeding and then complementary feeding, how to use the local food to give to the baby after exclusive breastfeeding for the 6 months. And then we also teaching the community how to detect early to the malnutrition if they not provide the good appropriate food to their children. So this is a method that we use in the community. So even based on the data that infant mortality rate is decreased, but on other hand is our malnutrition rate is increased. So we use this way. We do one pilot, one suku in Okusi district during the 5 years implementation of the project. When we implement from 100 is 50 of the 100 children that suffer from the malnutrition. But during the implementation the program, we found that from the 100 we get the only 5 children that suffer from the malnutrition. So education.
And that was just education alone, and talking with people.
Yeah.
My goodness.
Yeah.